All right, I am live. Let's see how many people are coming. Again, this is a pop-up Facebook Live. So if you have received my notice or email kind of late, um, you're not going to be able to enjoy this live. My name is Dr. TJ An. I think most of you know me already, so I'm not going to talk about who I am, etc. How are you doing? If you watch this live, please type in the comments that, hey, so and so from what region you're watching this. Beauty of this Facebook Live, by the way, it's being recorded. So possibly you can catch this later if I decide to keep this video after the live. Man, it's middle of May, and how most of you watching this video, you got, there you go, Danielle from Northern Virginia. Thanks for coming here, and I don't think I interacted with you before. I don't know if are you in our private Facebook group, the Podiatry Profits. If you're not, and if you're a podiatrist, please join. So this right now being broadcasted through my TJ An Coaching and Consulting business page, and also private Facebook group Podiatry Profits. However, this part one of series Evolution of Private Practice, it's really for every private practice owner, not just the podiatrist, which is who I am. And majority of my clients that I'm helping, but this applies to any private practice. Sounds good? I'm just gonna keep talking and welcoming people for a few more minutes before I start my presentation. It's like kind of semi-informal. Okay, I'm really, I got this idea for many years. I've been applying this idea to myself and also my clients whom I am helping. It kind of becomes more concrete. And through these uncertain times, COVID-19, pandemic, it even amplifies that what I've been preaching and what I've been practicing actually works even better. So that's why I'm like, okay, I should start educating more of this idea to private practice owners. So that's my way of helping you, providing value to you. All right, so I'm going to share screen. Let's see. Share screen. Not this way. This way is better. No. Sorry, guys. I'm going to stop sharing again. Not this screen, the other screen. There we go. All right. So, evolution of private practice. How to survive and thrive in modern healthcare crisis and uncertain COVID-19 times. Uncertain times, unprecedented times. How do you ride? Post-pandemic, post-COVID-19, how are you going to survive and thrive? I mean, that's really the point of this special series, evolution. So it could be, very interesting for some of you why TJ is talking about evolution. Well, about me again, I help private practice owners build profitable practices. That's basically what I'm focusing on. consulting side of me. I do have brick and mortar podiatry practice in Chicagoland area, focusing on minimally invasive for surgery. But I do have this second business that I help other doctors. So overview of this special presentation, we are going to mention and talk about Darwin and evolution. This is nothing to do with religion or, like contrary beliefs, or I'm opening to debate, anything like that. So, I'm not choosing some kind of side in a religious perspective, but I'm applying this idea to our business, our private practice. Okay. And, what we are facing now, it's very important to accept the reality. Okay. Like the worst thing you can do is you're in denial. Oh, I don't want to hear this. Oh, I'm not. Oh, I'm okay. I'll be fine. That's like denial. You can only do that so long. And you know it. If you're a private practice owner, you cannot be in a denial mode. You have to accept it. You have to observe and see how you can survive and thrive instead of like not accepting it. So then I'll show you how to adapt and change. So let's dive in. Well, the book, the research, right? The book, The Origin of Species, that was actually published in 1859. That's like 200, let me see, almost 200 years ago, right? Like close to 200 years ago. Crazy. So that was the original book. Okay. I don't know if you ever seen it. I've seen it first time when I Googled it. Okay. But the key is the natural selection, right? The word that I want you to focus is survival of the fittest. So when things around you die and you remain alive, right? That's survive. And the fitness or fittest, we're talking about adaptation, which enhances survival, right? But we'll go into detail. Well, what is this TJ doing, putting this Darwin theory, the survivor of the fittest, into this Facebook Live? Well, let's read this one. I'm just going to read line by line. Some people might be just driving, or this could have become a podcast episode. So I'll read it. Survival of the fittest. The individuals who are the best fit for the environment at the time will survive. If the environment changes, then the traits that are the most fit, it will change. Fitness does not always mean the biggest or the strongest. It can mean fewest parasites, fastest, smallest, best able to avoid predators, or attract a mate. Again, this is directly from the book. However, I'm going to kind of change the subject a little bit, but it is related. Changes of private practice over the years. It's going to be fun. Look at this, guys. Can you believe this is like 1930s and 40s? Doctors are in the advertisement of cigarette ads. That was the norm back then. That was a cool advertisement back then. Look at that marketing. More doctors smoke Camels than any other cigarette. That's the market at the time. Well, I believe this is from General Hospital TV show. So like 70s, 80s, 90s, maybe 80s. Authority, right? Respect. how people perceives doctor or private practice owners. Wealth. Ooh, I'm a doctor. That's the kind of market's perception. That's when it was hot and popular, the concepts. Then here comes like ER show. Doctors suddenly now become more modern, cool. There's some romance involved. See, images of doctors, perception of doctors, keep changing. Whatever that the trend or market at the time. Make sense so far? But then here comes this. Obamacare. I don't know. Some of you might be watching this from other part of the world, but majority of you are in the United States. Who would have thought this idea? I mean, idea was great, but then results in United States, let's face it, some people may disagree with me, but I'm in the midst of this whole beginning of Obamacare until to me, it's a failure for private practice owners and for patients. I'm just being nice. I'm trying my best to choose the nicest words because I'm on live. This really messed up the private practice. But again, I'm not here to blame someone or some system. Let's not do that. Just accept this stuff as a fact. It's really that's what happened, right? But I'm not going to just sit there and then blame and, not do anything about it. Just look at this graph. I'm going to show you a couple of graphs. This is the deductible from 2008 to 2018. Some of them are way more than 200%, I know, but this is the average. The bottom here, by the way, is a typical inflation or workers' earnings. You see how much the gap has resulted? Here's a Medicare cut, similar time from 2000 around 2010, around there. Look at this from 2008 to 2015. How much Medicare reimbursement dropped from here to this. And now the value-based reimbursement. Fee-for-service is gone. If you're participating in insurance networks, it's almost gone. Only few insurance still pay you fee-for-service, but this idea is much more prevalent now. Sounds good. Condense, reduce the cost, healthcare cost, etc. But to whose expense? For example, us podiatrists, I always put example for bunion or hammer toe. Now bunion, you get a reimbursement like $500, $600 tops for Medicare for 90 days. In the name of value-based bundled payment, you cannot bill anything else for those post-operative 90-day grace period. What if patient has some complication? What if you have to follow up? What if you have to take x-rays? I mean, don't you use your resources, your expertise, your staff? But $500 for 90 days? I mean, in any normal business sense, does that make sense to you? To, again, be in denial mode and then just pretend you don't hear it, pretend it doesn't apply to your practice, and then just keep increasing the number of patients you have to see? Aren't you a human? Don't you want to have some free time with your family? Don't you want to do some hobbies that you love doing, passion? Don't we all live in one damn life? And you're spending. Some doctor I helped, he's my client now. He has multiple offices. He's the owner of the whole practice, like 5-6 locations. Works until 1 a.m. He has to depend on volume. Why? Because of this value-based reimbursement, the healthcare reform, Obamacare, insurance-based, that force you to become volume-based private practice owner. Okay? And then ACO comes, right? The accountable care organizations. So what's happening? The big institute, private equity group, government grant, lobbying, trying to gather all these healthcare issues into a big system and start gulping up private practice owners, private practices, smaller surgery centers, smaller medical providers. It's like a factory, right? Where is that patient-doctor relationship? I don't care what all the fancy words they put it in a phrase. Oh, better healthcare, better managing medications, better social, etc., like you can see in this graph. But look at that, reduce preventable hospital admissions. Hospitals don't want to do any surgeries now. They don't want to keep patients in the hospital. They want to send them home. Why? Because kind of same thing. Hospitals are facing the same reality. No matter what kind of care they give, it's a bundled payment. So they can only get so much for a certain condition. So if they can, they just send patients outside of the hospital. Again, because of this big private equity group, big money coming in to this type of ACO, HMO, the bigger institution style of healthcare, it brings big, giant, brand new hospitals to reality. Have you seen that in your neighbor? Suddenly, the old hospitals getting bought by big money, and then they kind of transform to like fancy, beautiful, like hotel-like big hospitals. I'm not, again, pointing any of these hospitals. I just picked 2 hospitals. Okay, so I'm not against this. I want to put disclaimer here. But I'm talking about, where is this money coming from? Tax money? Your reimbursement cut over the years, past 10 years? And then patients? What about their deductible coinsurance and their out of pocket? Oh, Daniel, thank you. Thank you for a nice comment, Daniel. So private practices, guys, cannot survive. I mean, if you disagree, put it in a comment. How can private practices survive? How can they with this current environment? If you insist and persist what you've been doing and being in denial, I just want to know if you know some kind of other magic bullet is available, magic like silver bullet. Let me know. Let everybody know in our group. The only solution I can see in this setting is just to see more volume. Okay? So if you do not change or adapt to the environment and the market now, I don't see how you can survive as a private practice owners. So On top of them now, we have a pandemic. Okay, again, could it be conspiracy? Could it be reality? Doesn't matter. The fact is that a lot of private practice owners have been forced to shut down their practices since like March. Some states I know until like July. So let's go back. The reason why I showed you the Darwin's the origin of species and survival of the fittest. It's about time. So he says, it's not the strongest of the species that survive, nor the most intelligent, but the one most responsive to change. The one most responsive to change will survive. But I'm going to add on top of that, not only they will survive, but you will be able to thrive. Hey, Jack, nice to see you here in the live. We've been talking about the evolution of private practice, Jack. So you don't have to be the strongest. You don't have to be the most intelligent. How nice, how easy is this? You don't have to like pump up the muscle and then become the biggest muscle guy, girl, or you have to study so much and you have to like beat everybody by like, I don't know, math tournament or chess tournament. You have to study so hard. It's not. You have to be able to have a keen eye to current environment and be open enough to adjust yourself and change. That's all I'm asking. Hi, Estella. Nice to see you here. Pediatrician, great. There we go. I like that point. That's where I'm going there. Great, Estella. Yeah, so solution is, again, you need to be able to be responsive to change. So again, that book, that's why I showed you this evolution. Again, I'm not taking any religious view perspective here, okay? The point here, how can we apply this idea to our private practice? So evolution of private practice, okay? Look at those Darwin's, again, book, like how birds change their beaks, the style of beaks, the function, it evolves to fit to the environment to survive. The various shapes to function better, to survive. And then the little picture on the mobile phone right here, you see what's hidden? It's a brown color moss. But it adapts to environments so that the predator doesn't eat this moss, so they can reproduce and survive. Adapting to the environment. So here's the thing. For business, private practice owners, the market is the environment. Okay, here's how I'm applying this now. The market is the environment. And now to survive and thrive in this healthcare market, healthcare crisis, pandemic that I've been telling you, you need to change and adapt now. Again, you guys can, so Dr. Estella here, put her secret, which I agree 100%. So other than those kind of changing yourself and adapting yourself, tell me if there is a way to survive how you've been practicing for years based on insurance plans and based on volume. I don't know. I don't know how you can survive, but I'll tell you the solution. This is the solution. So remember I showed you this and I read line by line. Now I'm going to convert to private practice. How much resemblance you'll see. The private practice owners, so I'm reading the line, the private practice owners who are the best fit for the environment at the time will survive and thrive. I'm almost paraphrasing the origin of species, survival of the fittest, to private practice owners right now. The second one, if the environment changes, then the traits that are the most fit will change. This one, I didn't even change a word. Third one, the fitness does not always mean the biggest hospitals or the strongest insurance companies that you like associate with. Does that make sense? You don't have to be forced to participate in the biggest hospital or the strongest insurance network. You don't. I'm telling you, you don't need to. The last point. So it can mean the fewest unnecessary expenses. So I'm trying to show you the solutions. It can be something you change your practice so that fewest unnecessary expenses, apply disruptive marketing tactics, more efficient business model or practice model, and also like that the book, Best Able to Avoid Predators. So best able to avoid insurance networks, ACOs, private equity partners, or attract quality patient leads. Now you can do that. That, by the way, you don't need to avoid it, right? You want to attract. Kind of little, possibly, I wrote it a little bit funny way. Thank you, Eslala. By the way, in addition, here's the good news. I want you to pay attention. Sometimes the worst crisis, it looks like the worst crisis could be the biggest opportunity for you. If you can see that. So it's not all about survival here right now. Again, I'm not going to go into detail. There's a like demand and supply, right? If there's a huge demand but lack of supply, that's where you come in. The huge market advantage, competitive advantage. This is actually, to me, once in a lifetime opportunity in your career if you're currently practicing. So it's not all bad, You can join the ride to I call it new golden era of private practice. Well, some of you who have been practicing for many years, you've seen those golden era of medical practice. But I'm talking now, if you can see this new market, new environment, if you can see it through and apply and change and adapt to this environment, you might be riding and enjoying this golden era of private practice by you becoming the new breed of private practice. I have proofs, by the way. Myself and a lot of doctors I have helped. They're enjoying this ride. And I want you to join. Instead of worrying about how many patients you will have to see next month to survive, what kind of revenue you need to generate to pay your employees, not just the employees, pay yourself, your mortgage, rental for your private practice locations, or tax. So it's time to adapt. So I'll tell you 3 adaptations. So TJ, just don't tell me the theory. So what are those 3 adaptations? If I say 3, okay? Might be more, but this is the 3 most important adaptations or change you can do right now. You need to develop and create premium services. You cannot rely on the low-hanging fruit generalized service. You have to specialize. Even if, let's say, you're an internal medicine doctor, you can still specialize within your own specialty to create premium services and solutions that patients want. I'm not telling you to create some kind of the most expensive treatment plan that doesn't work. I want you to start looking for and create the premium service that works, differentiate, and then great for the patients. So patients want them. Number two, you need to learn how to fill up your schedule with this type of highly qualified patients who wants premium services and solutions. Again, you need to have an open mind, okay? I know because I've talked to so many doctors, my on phone call, my own clients or who before they became my clients, a lot of, including me, right? It's hard to shift mindset. So mindset is underlying most important foundation that you need to shift, but I'm not going to put that here because that just governs this whole change and adaptation. Without the proper mindset, open-minded, and see the different perspective, if your mind is blocked, if you're like egotistic, if your mind is confined and stubborn, I'm not going to change. I'm not going to change. No, don't talk to me, TJ. It's not going to change. Then you know what? That you heard this word, right? If you're not doing anything different, but you're expecting the different results, that's the definition of insanity. You keep doing same thing over and over and expecting the different results. That's the definition of insanity, right? So have them open-minded and then hear me out. You need to have a different service, high-level service that patients want. Even if in the appearance, it may look expensive, but what if you provide something completely different experience to these patients? There are enough patients out there who are sick and tired of this factory-like, commodity-like healthcare. There are enough patients all over the world who can afford this type of premium services. And what if you can fill up your schedule with this type of qualified patients? What if there is a vehicle? What if there is a system that does this? Number three, you need to be able to ethically influence, ethically persuade your patients so they pay out of pocket with little resistance. You don't have to be a salesman or a woman. You don't have to be pushy. You don't have to manipulate. What if, as a doctor, from the place of wanting to help your patients for the best treatment solutions, if you can influence patients' decision-making process ethically, so they cannot wait to receive treatment solutions from you? Wouldn't it be different experience for patients who's so sick and tired of waiting for seeing their primary care physicians and waiting for specialists for 8 weeks and then wait for like another 12 weeks to 16 weeks to get some kind of procedure done? So these three adaptations is not only doable, but this will make you survive and thrive, future-proof. Who knows what kind of crisis become added to what we already have right now. So you will survive and thrive. So the part 2, I don't know when I'm going to do the live. Again, this is sort of experiment. I split to 3 series. And then the first one is like accept the reality and there are solutions. That's something that I wanted to convey to you. It needs to be evolved. You need to change. Part 2, these 3 series I told you about, 3 adaptations. I'm going to go into detail of these 3 adaptations and changes that you can do. And I'll show you the proof, the actual number, actual strategies and tactics along with actual number generated by private practice owners. Sounds good? If you're watching this from my business page, please join my free private Facebook group. Well, if you're a podiatrist currently practicing, and you want to go a little bit dive deeper in a more podiatry specific, join this group. If you're not a podiatrist, still contact me, because again, I help doctors, private practice owners, do crazy marketing, something very different from typical branding, typical broadcasting, shotgun approach marketing, so that you can attract qualified premium patient leads, and then how to book them and how to provide them your VIP, the best experience to your patients, how you can generate organically without spending any money in an advertisement, how to generate 5-star reviews and social proofs, and how we can, cultivate as a part of pillars, part of moving parts. So you generate this system. Majority part is delegated and automated, so you can enjoy your free time with your family and for yourself. Your hobbies, travel, it's possible. I work 3 days a week for my podiatry practice right now, and so you can, no matter which specialty you have. 100% confident about that if you adapt and change to new environment. Equip yourself with strong expertise, strong value-driven, results-driven private practice owners for your patients. So I'm going to cover more in the part 2. So again, thanks for joining this live. This is totally pop-up live, so I didn't expect many people to show up, but that's okay. I'm going to keep this video live on the Facebook, so you can rewatch this. And I am looking forward to seeing you either in my Facebook group, or send me an email, or my website, through my website, and then we'll keep going. Don't give up. Don't give in. Okay? I want you to thrive and increase your private practice profits, double or triple. Then I'll be happy. I'll be grateful. All right, I'm going to end this broadcast, this Facebook Live. Thanks for joining, and I'll see you soon.